Hello and welcome. Today we're discussing a condition that, while rare, can be quite concerning: priapism. This refers to a prolonged and painful erection unrelated to sexual stimulation. It's crucial to understand this condition to ensure prompt diagnosis and treatment. So, what causes priapism? The causes are varied. Some of the more common factors include blood disorders like sickle cell anemia and thalassemia, certain medications such as antidepressants, blood thinners, and drugs for erectile dysfunction, recreational drug use, specifically cocaine, neurological conditions, and even trauma to the penis or perineum. In some cases, the cause remains unknown, referred to as idiopathic priapism. To understand priapism, let's briefly delve into the pathophysiology. There are two main types: ischemic and non-ischemic. Ischemic priapism, also known as low-flow priapism, occurs when blood gets trapped in the erectile chambers of the penis. This is due to a problem with blood leaving the penis. The stagnant blood becomes oxygen depleted, leading to pain and potential tissue damage. Non-ischemic priapism, or high-flow priapism, on the other hand, happens when an artery in the penis ruptures, often due to trauma. This causes a constant, uncontrolled flow of arterial blood into the erectile tissues. Priapism is a relatively rare condition. While precise epidemiological data is limited, ischemic priapism is more common than non-ischemic priapism. It's often associated with underlying medical conditions like sickle cell disease, particularly in younger males. The incidence of priapism increases with age, partly due to age-related medical conditions and medication use. The most prominent symptom, of course, is a persistent erection lasting longer than 4 hours, unrelated to sexual interest or stimulation. In ischemic priapism, the erection is usually fully rigid and painfully tender. The penis may feel hard and stiff. With non-ischemic priapism, the erection may be only partially rigid and less painful. It might feel softer than a full erection. Diagnosis typically involves a physical examination by a physician. They will assess the rigidity of the penis and any tenderness. A blood sample is usually taken to analyze blood gases from the penis. This can differentiate between ischemic and non-ischemic priapism. Doppler ultrasound may also be used to assess blood flow in the penis and identify any arterial abnormalities. As mentioned earlier, priapism is broadly classified into two main types: ischemic, or low flow, and non-ischemic, or high flow. Ischemic priapism is the more common and more serious type, requiring urgent medical intervention. A less common type is stuttering or recurrent priapism, where there are recurring episodes of ischemic priapism. Treatment depends on the type of priapism. Ischemic priapism requires immediate medical attention. Initial treatment often involves aspiration, where blood is drained from the penis using a needle and syringe. This may be followed by injection of a medication called phenylephrine, which constricts blood vessels and reduces blood flow to the penis. If these measures are unsuccessful, surgery may be necessary to create a shunt, allowing blood to flow out of the penis. Non-ischemic priapism often resolves on its own. However, observation, ice packs, and compression may be used. In some cases, selective arterial embolization, a procedure to block the ruptured artery, may be required. Unfortunately, there's no foolproof way to completely prevent priapism, especially when the underlying cause is unknown. However, for individuals with sickle cell anemia, careful management of their condition can help reduce the risk. For those taking medications known to cause priapism, discuss alternative options with your doctor. Avoid recreational drug use, particularly cocaine, which has been linked to priapism. The prognosis for priapism depends on the duration of the erection and the promptness of treatment. Prolonged ischemic priapism can lead to permanent erectile dysfunction due to damage to the erectile tissues. Early diagnosis and treatment are crucial to preserving erectile function. Research continues in understanding the underlying mechanisms of priapism and developing more effective treatment strategies. Current research is looking into genetic factors that might predispose men to the condition. Also, researchers are experimenting with new medications to help prevent recurrent priapism in patients with sickle cell disease.